And I want to thank the members of our distinguished panel for coming to join us. I'd like to introduce from the Canadian Psychological Association, Dr. Cohen, who's the Chief Executive Officer. I'd like to introduce Dr. Francine Lemire, who is the Executive Director and Chief Executive Officer of the College of Family Physicians of Canada. And I'd like to introduce Mr. Philip Emberley, who is the Director of Professional Affairs of the Canadian Pharmacists Association. Welcome to all of you, bienvenue, et j'apprécie énormément que vous êtes venus témoigner de votre.
Welcome. I really appreciate that you were able to come appear before the committee. We'll be starting with Ms. Cohen, and each witness will have 8 minutes.
Thank you so much, Dr. Cohen. Thank you so much for coming.
Thank you. Good evening, and thank you, honourable members of the committee, for giving the Canadian Psychological Association the opportunity to speak to you this evening about Bill C-14. The CPA has 2 specific concerns with the bill. The first concerns the role of health providers in end-of-life decision-making. The second concerns the assessment of a person's capacity to give consent to end his or her life, particularly when a psychological or cognitive disorder is concomitant with a grievous and irremediable physical one. Accordingly, we have 3 recommendations that we're asking you to consider. Section 241(1) notes that it is an offence to counsel a person to die by suicide and to aid a person to die by suicide. Section 241(2) and 3 appear to exempt practitioners from the provisions of 241(1) if they provide medical assistance in dying or aid a practitioner in providing medical assistance in dying. CPA's concern is that the exemptions articulated in 241(2) and 3 appear relevant to aiding a person in dying, but not to counseling a person about an end-of-life decision. While 2 and 3 appear to exempt practitioners for involvement in the act of dying itself, regulated health providers will reasonably be involved in decision-making before any end-of-life act is carried out. Psychologists would be among the health providers who might assess a person's capacity to give consent to medically assisted death. Psychologists would also be among the providers to whom persons with irremediable conditions might bring their end-of-life concerns. It is important that persons who are considering hastening death have the opportunity to bring their concerns to a trusted, regulated health provider if they so wish. It is equally important that a regulated health provider who enters into an end-of-life discussion or consultation with the patient also be exempt from 241(1). Our first recommendation is for an additional exemption that stipulates that no regulated health practitioner commits an offence if they assess a person's capacity to give consent to an end-of-life decision and/or provide counselling regarding end-of-life decision-making issues at the request of a person with a grievous and irremediable condition, or if they aid a health practitioner in the assessment of a person's capacity to give consent to an end-of-life decision and/or in the discussion of an end-of-life decision for a person with a grievous and irremediable condition. We also want to note that the word counsel in English used in 241(1)A has both legal and profession-specific meaning. Mental health providers like psychologists can be said to regularly provide counseling to their patients. In this sense, counsel has a very different meaning than the one intended by 241(1)A. Our second recommendation is that 241(1)A be revised such that counsels be replaced by persuades or encourages. It would then read, persuades or encourages a person to die by suicide or abets a person in dying by suicide. Finally, the CPA was also concerned that the bill is silent on how capacity to give consent should be assessed. While in many instances it may be straightforward to ascertain that informed consent can and has been given, there may be times when it may not be. Examples might be when a patient has a cognitive or psychological disorder concomitant with a grievous and irremediable physical one. The concomitance of a cognitive or psychological disorder with a physical one occurs commonly. CPA's submission to the expert panel that reported to the parliamentary panel made the following point, and I quote, "The global experience of suffering, including suffering due to physical symptoms, is much more pervasive among terminally ill patients who are depressed than among those who are not depressed. In the Netherlands, Dees and his colleagues have reported that only patients with a comorbid diagnosis of a mental disorder suffer unbearably all the time. Hence, it is likely to be a common scenario for depressed, terminally ill patients to make requests for assistance in ending their lives. To prepare for this, legislation should be informed by certain clinical realities. A mere diagnosis of depressive disorder does not necessarily mean that someone is incompetent to make critical health decisions. Especially severe depression, however, may result in negative attitudinal biases that distort rational decision-making around medical aid in dying. The assessment of a person's capacity to give informed consent, particularly when that person has a concomitant psychological or cognitive disorder, must be left to those regulated health providers with the training and expertise to undertake these kinds of complex assessments. It is CPA's view that psychologists, along with physician specialists such as psychiatrists and neurologists, have the necessary training and expertise. Our third and final recommendation is that a new provision be added under safeguards as 241.23 as follows. Ensure that when a person presents with a grievous and irremediable medical condition, concomitant with a cognitive and/or psychological one, the person's capacity to give consent be assessed by a regulated health provider whose scope of practice includes the assessment of cognitive and/or psychological conditions. On behalf of the CPA, I thank you for your important work in the interests of the Canadian public. I'd be glad to answer any questions about our submission.
Thank you very much for your presentation, Dr. Cohen. On va passer à Dr. Lemire.